My name is Ruby Neal, and this video will give a brief report on the findings of my literature reviews I did throughout the term. And these studies cover various topics related to substance use. The findings I made are broken into 4 topics, which are listed on the slide. These topics will be presented through the next following slides, which summarize the articles. The first study I looked at had an online survey of 357 pregnant people. They used a theoretical framework called syndemics and measured survey responses to sexual minority identity, prenatal substance use, partner violence, housing satisfaction, demographics, and medical information related to pregnancy. The study found that of the 125 pregnant people who identify among a sexual minority, they were more likely to engage in substance use than the heterosexual participants. However, they did not confirm the association by syndemic factors. The next article is called Genetic and Shared Environmental Factors Explain the Association Between Adolescent Polysubstance Use and High School Non-Completion. The study examined a sample of 9,579 adult twins to investigate an association between substances used during high school and high school completion. The genetic environmental factors were examined by discordant twin design and bivariate twin analysis, which examined for drug exposure effects and whether family influences that were common to the association were genetic or environmental. And they did confirm that the association was largely accounted for by genetic and shared factors. The last study in this topic is mental health and substance use factors associated with sexual violence, victimization, and perpetration in university samples. This study used a biopsychosocial model to examine mental health of college students by the factors listed on the slide. The study design was a meta-analysis of 101 research studies. They found 9 mental health factors that were positively associated with sexual violence, and they're listed there. They also found that sexual violence, victimization, and perpetration was positively associated with substance use. For the next topic, the first article is, do changes in mood and anxiety mediate exercise-induced reductions in alcohol cravings? The method was a randomized clinical trial of 117 adults with clinically diagnosed alcohol use disorder and indications of alcohol cravings. They each did a 12-minute fitness test, and reports of anxiety, cravings, and mood states were reported before, right after, and 30 minutes after the exercise. They found that anxiety reducing during exercise had a greater chance of reduced alcohol cravings over those whose anxiety got worse or stayed the same. The next article is Hoarding Behaviors and Alcohol Use, the Mediating Role of Emotion Dysregulation. This study examined self-reports on measures of hoarding, depression, anxiety, alcohol use, and emotion dysregulation of 574 adults. The results indicated that symptoms of alcohol use disorder and hoarding behaviors was mediated by difficulties regulating emotions. They conclude that alcohol might be a way people with hoarding symptoms regulate their emotions. So the next topic, the article for this is Neurocognitive Correlates of Non-Substance Addictive Behaviors. They examined a sample of 475 people and the neurocognitive correlates of problem alcohol use, addictive eating, problematic pornography use, and problematic use of the internet. They found no association between neurocognitive domains and problem alcohol use and addictive eating. They found poor performance monitoring was associated with high PPU and PUI, and a preference for delayed gratification was associated with severe PUI. And then for the last study is substance use disorders and risks for treatment-resistant depression. They examined data on a sample of 121,669 people with depression from 2009 to 2014. 15,631 people were identified as TRD cases, and they found that individuals with depression and engaging in substance use before or during depression intervention were more at risk of treatment-resistant depression. And this is a list of my references, and that completes my presentation. Thank you so much.